Hi, my name is Jennifer Geisler and I chose to do my video on Asperger Syndrome, and here it is.
What is Asperger Syndrome? Asperger's is a pervasive developmental disorder. This means it causes significant problems in many areas of development, including socializing with others, thinking, emotions, intense preoccupation with one or two topics, repetitive routines, behaviors, and movements, play, speech and language, motor skills, and sensitivity to sensations of sound, light, or touch. Thinking problems of Asperger syndrome: unawareness of others' feelings, inability to read other people's intentions, inability to see other person's perspective, inability to tell what others are thinking, interpreting others' words literally, viewing things in black and white, rule-bound thinking, perfectionistic thinking, catastrophic thinking, rigid thinking, persuasive thinking, and failure to generalize. Prescribed interest fixation in particular subject or object, and no curiosity about anything else. Examples: trains, MTA, presidents, dates. Gains extensive expert knowledge in this area. Turns attention to this topic in most conversations. Little interest in other topics. Shows off knowledge in almost encyclopedic manner. Social interaction issues. The Asperger child does not engage in normal eye contact, show much interest in other people, display empathy for other people, share in the interest and achievements of others, understand body language, converse on topic, respond to what others are saying, and read social cues. Asperger's and comorbidity. Most students with Asperger's have additional serious issues beyond this diagnosis. Some common co-occurring disorders include anxiety disorder, depression, OCD, ADHD, bipolar disorder, oppositional defiant disorder. Routines, behaviors, and movements. Preference for routine may become irritable, upset, tantrum, or meltdown due to minor changes. Anxiety is reduced when there is a sense of control and change is predictable. Imposes routine on others. Behaviors he or she must do. Movements that seem senseless or odd, stimming. Motor skills problems. Fine motor skills, difficulty tying shoes, hard to button and zipper jeans, illegible handwriting, difficulty holding pen, messy eating habits. Gross motor skills, trouble with coordination, posture, gait, perceptual skills, and balance. Sensitivity problems, sensitive to taste, textures, and smells, visual input, overly reactive to lights, loses place when reading, misjudges, spatial relationships, may bump into people or things, auditory input, loud noises can be extremely painful, may cover ears during fire drills, in cafeteria, etc., may complain about car horns outside of class. Diagnostic criteria for Asperger's disorder. Qualitative impairment in social interaction, as manifested by at least two of the following. Marked impairments in the use of multiple nonverbal behaviors such as eye-to-eye gaze, facial expression, body posture, and gestures to regulate social interaction. Failure to develop peer relationships appropriate to developmental level. A lack of spontaneous seeking to share enjoyment, interest, or achievements with other people. For example, by a lack of showing, bringing, or pointing out objects of interest to other people. Lack of social or emotional reciprocity. Restrictive, repetitive, and stereotype patterns of behavior, interests, and activities, as manifested by at least one of the following. Encompassing preoccupation with one or more stereotyped and restricted patterns of interest that is abnormal either in intensity or focus. Apparently, inflexible adherence to specific non-functional routines or rituals. Stereotyped and repetitive motor mannerisms, for example, hand or finger flapping or twisting, or complex whole body movements. Persistent preoccupation with parts of objects. The disturbance causes clinically significant impairments in social, occupational, or other important areas of functioning. There is no clinically significant general delay in language. Example, single words used by age 2 years, communicative phrases used by age 3 years. There is no clinically significant delay in cognitive development or in the development of age-appropriate self-help skills, adaptive behavior, other than in social interaction, and curiosity about the environment in childhood. Criteria are not met for another specific pervasive developmental disorder or schizophrenia.